Hi, I'm Marc Nevins, and this video will present the Marc Nevins implant being utilized for immediate loading with ridge augmentation. This patient presents with the need to replace the maxillary right central incisor. There is adequate bone for implant placement, however there is a significant hard and soft tissue ridge defect. We've reviewed the CT scan and we have a stereolithic guide to aid in placement of the implant via the site preparation drilling. We will make a surgical flap access as we'll be providing both hard and soft tissue grafting for this site. The flap is elevated with a full thickness flap, and once this has been provided, a modified double pedicle suturing technique is utilized to repair the clefting of the fragile tissues at the site of the central incisor where there had been extensive recession prior to the previous extraction and ridge preservation procedure. 3 modified double pedicle sutures are placed, and once these have been placed, the guide is fit into place. The first drilling is with a 2mm twist drill, and this is accomplished to the implant site prepared depth of 13 millimeters. A conical drill is then utilized to further prepare the implant site, and then the rest of the preparation will be provided via multi-drills as part of the Marc Nevins implant system. The multi-drills cut extremely precisely, and here we can see the 3.7mm multi-drill number 3 being utilized. The final multi-drill, the number 4, is only being drilled to about 8mm, as this will be an immediate load case and we want slightly more primary stability. The implant's inserted at a 45 Newton centimeters of torque, and we can see the primary stability that is achieved. Looking at the implant placement in slow motion, we can observe the affinity for the blood to the sandblasted acid-etched implant surface, which will be favorable for establishing a fibrin clot, which is important for the osseous healing and osseointegration. An abutment is tried in, and then we go to the palate to harvest our connective tissue graft using a parallel incision technique. We need a significant graft to enhance the soft tissue thickness. Once the graft is harvested, the palate is sutured, and then we'll suture the graft to the repaired buccal flap using 5/0 chromic gut sutures. We can see a single continuous suture being used to stabilize the graft to the outer flap. Once that has been completed, we're now going to place our growth factor enhanced bone matrix, which is a combination of base bone, freeze-dry bone allograft, demineralized bone matrix, and recombinant human platelet-derived growth factor. And the graft material is carefully condensed into place to add our hard tissue contour graft to our soft tissue graft in our double pedicle technique that has been utilized. The flap is then going to be closed with cytoplast sutures, and then the provisional crown will be relined and then will be cemented with provisional cement. We can see the postoperative radiograph immediately post-surgery, and then the patient returns at 4 weeks. We actually re-cemented the crown as it was loose, and we were able to have a good look at the soft tissues, and also we're able to obtain a new periapical radiograph which evidences the healthy bone profile around the fixture as it is healing. Little Implant Company looks forward to sharing more surgical videos with you in the future.